How we doing today?
Good, how are you?
Good. My name's Lacy. Yeah, go ahead and have a seat. Thank you so much. What's your name?
Emily Howell.
Nice to meet you, Emily. I'm Lacy. What's your date of birth?
07/23/96.
Awesome. Good deal. I'm just going to wash my hands real quick. All done. Do you know why you're here today?
To do a head to toe test.
Awesome. Do you know where you are?
Amy's house.
And what's the date?
It is the 28th, I believe.
It is. Okay, well, good. You seem alert. You seem oriented to time and place and all that good stuff. So I'm going to ask you to remember, I'm going to tell you 3 words. Okay? Hospital, car, and ball.
Okay.
Can you repeat those back to me?
Hospital, car, and ball.
Good deal. Do you have any health issues?
I'm pretty healthy.
No. What about family history? Anything, diabetes, nothing like that? How about allergies?
Nope, no allergies.
You take any medications every day?
Nope, I don't take anything.
Okay, good deal. So we're alert and oriented times 4. Do you have any pain today?
Not any.
Okay, good deal. How tall are you?
I'm 5'3".
5'3". And how much you weigh?
200 pounds.
Okay, good deal. All right, so let's calculate your BMI. That's going to be 35.4. Okay? All right, so to start off your head-to-toe assessment, I'm going to go ahead and check your vitals. Okay? So the first thing I'm going to do is check your temperature. This is just going to go in your ear. I'm sure you've had this done before. All right, 98.2. Perfect. Thank you so much. Okay, next thing I'm going to do is palpate your radial pulse. So if you'll just sit. Okay. Awesome. So I also checked your respiration. You didn't even know I did that, did you?
Oh, really?
Uh-huh.
Okay.
So your respirations are 16, which is totally normal. You want to be in between 12 and 20. Your heart rate was 81, which is also normal. You want to be between 60 and 100.
Okay.
So now we're going to take your blood pressure, and I'm going to do this fancy thing called the 2-step method. Okay? So if you'll just sit comfortably with you, make sure your legs aren't crossed for me. Let's see your arm. I'm going to palpate for brachial pulse. Feels good and strong. Okay. So what I'm going to do is pump it up until I can no longer feel your brachial pulse.
Okay.
Right about there. Okay. And the next thing I'm going to do is listen for it. So I'm going to pump you back up to about 30 millimeters of mercury higher than what we were. All right, good deal. And you are at 118/78, which is normal. You want to stay under 120/80.
Okay.
Okay, good deal. So you remember earlier I asked you to say those 3 words? Can you repeat them back to me?
Hospital, car, and ball.
You are so perfect. So that's testing our short-term memory. I'm going to test your long-term memory. Where were you born?
Lewiston, Mississippi.
Good deal. Okay. And then we're going to test, I want to ask about your daily activities. Is there anything that's preventing you from, doing everything on a normal everyday basis, like, walking or driving or anything like that? Okay. Good deal. And we don't take any medications, correct? All right. Let's grab, we don't need that just yet. Just kidding. I want to test for your arithmetic. So do me a favor and count backwards from 100 by Stebbins?
It's 193. 84. I'm gonna say. I don't know.
Oh, yeah, okay, all right.
Something
Good
around
deal,
there.
good deal. Okay, and now to kind of test your judgment and your reasoning. If you were on fire right now, what would you do?
Besides scream, probably stop, drop, and roll.
Good deal, good deal. So our reasoning is intact. Do you hear or see anything that other people don't see?
I don't think so.
Okay,
Hope
so
not.
that tests behavioral function, and we should be good there. So now we're about 5 minutes in. Repeat those 3 words for me one more time.
Hospital, car, and ball.
You're the bomb. Sounds good. So the next thing I'm going to do is move on to inspection. We're going to start at the top and just go on down. So I'm going to look at your head, and we are looking through the hair. I'm looking at the texture, the color. Everything seems to be normal, normocephalic. I don't feel any lumps or any asymmetries, no lice or nits or anything like that. No involuntary movements or jerks. So good there. Let's go ahead and look at our temporal arteries. Everything feels good here. Another thing, anytime I touch you, that's called palpation.
Okay.
If at any time I touch you and it hurts,
Mhm.
I want you to let me know.
Okay.
Okay? Because that may not be normal. So let's go ahead and take a look. So again, those temporal arteries, we don't have any, lumps or anything there. Shape of the head looks good. Shape of the face looks good. We're not asymmetrical. We're good there. Our eyes look symmetrical. Let's go ahead. You'll look up for me. Look down. Conjunctiva looks normal. Sclera is nice and white. No discharge. Very pretty brown eyes. So we're doing good there. Our cornea looks good, clear. The next thing we need to talk about is vision problems. Have you ever had any in the past?
Not really.
Okay. You don't wear contacts, glasses?
I wear reading glasses.
Reading glasses.
Mhm.
Were they prescribed to you?
Yes, they are prescribed to me. I see my eye doctor
Okay.
once a year.
Okay.
So annually.
Good deal. All right. So no vision problems. Cranial nerve 2 seems to be intact. So I don't think there's any. Well, let's test cranial nerve 2 with our periphery, actually. That was my fault, excuse me. That's testing cranial nerve 5 is the vision problems. Okay, so what I'm going to do now is test your peripheral vision. I'm going to reach behind you a couple of times, didn't want to scare you,
Okay.
and I'm going to wiggle my fingers, and when you can see them, you let me know.
Okay.
Okay?
Yes, ma'am. Yep.
Awesome.
Yep.
Kind of like I'm going in for a hug, huh?
Yep.
Okay, good deal. So cranial nerve 2 seems to be intact, and now I'm going to get out my fancy little pen light.
Okay.
So what I'm going to do is test for direct as well as consensual perla, and that means that your eyes are reactive to light, round, equal, all that good stuff.
Okay.
Okay? All right, direct looks intact. Let's look for consensual. Very good. Seems like we're doing okay. And just to make sure again that I don't see any kind of drainage or anything like that. So everything looks good. Now we're going to look at your 6 fields of cardinal gaze.
Okay.
So what I want you to do is follow this pen with your eyes. Don't move your head. Okay? And we are going to start by going up. Good deal. So that seems to be intact. We're looking at a couple of different cranial nerves there. Everything looks good. Cranial nerve 3, cranial nerve 4, cranial nerve 6, all that good stuff. Okay? And the next thing, actually, I need my pen again. We're going to test for accommodation, which tests cranial nerve 3.
Mm-hmm.
So what I want you to do is take a look at something back here. How about that doorknob?
Okay.
That look good?
Mm-hmm.
You just looking off in the distance. So also, all right, look at my pen.
Okay.
Back to the doorknob.
Okay.
Back to the pen.
Gotcha.
Back to the doorknob.
Gotcha.
And back to the pen again.
Okay.
Okay, good. So cranial nerve 3, 4, and 6, extraocular muscles seem to be all intact, seem to be good there. Okay, next thing we're going to look at are our ears. So I'm just going to inspect, palpate a little bit, make sure there's no masses. Everything looks symmetrical. There's no tenderness. I don't see any drainage. Everything looks good. Any hearing problems?
Mm-hmm.
No? Okay. All right, and also no vision problems, anything like that. So the next thing I need to look at are your sinuses. I was going to palpate your face.
Okay.
So our frontal, any tenderness there?
No, ma'am.
And maxillary?
Mm-mm.
Okay, good deal. So the next thing we're going to do, excuse me, my watch keeps trying to fall off of me there. So now let's take a look into your mouth. I'm going to open up my little popsicle stick here. And just open wide for me. Say ah, and try to swallow. Perfect. Okay. So that swallowing and saying ah test cranial nerves 9 and 10. Looks like those are intact. Looks like our oral mucosa is nice and pink. I don't see any kind of drainage or any abnormalities. Show me your teeth. Okay. Doesn't look like there's any kind of caries or any teeth missing or anything like that. No discoloration. Everything's intact. So we should be good there. And you said you haven't had any trouble hearing, correct?
Mm-mm.
Okay. So that's where that's what we were testing for cranial nerve 8.
Okay.
So we should be good there. Okay. Let's see what we need next. I do need my little pen light, don't I? Because I need to look into your nose. So we're going to look at this for symmetry. Looking into the nares, making sure they're nice and pink, making sure there's no evidence of deviated septum. Any problems smelling, anything like that?
Never.
Okay. All right. I think we should be good to go on that end. So thank you so much for that. I think we're going to be moving on along here. Let's see what I need next. I don't need those yet. Keep on going. So we already looked for facial symmetry, which tests for cranial nerve 7. So let's do a little bit more testing on the symmetry. Go ahead and raise your eyebrows for me. And puff out your cheeks. And smile. Great. So all symmetrical there. No problems. Go ahead and clench your jaw. Awesome. And I'm testing, just palpating those muscles right there. Now open and close for me. Close, close. No obvious popping or crepitus. Okay, now open and then move your jaw from side to side. Okay, and that's looking at cranial nerve number 5. So then take your tongue and push it to the side of your cheek and try to resist. And other side, good deal. Now stick your tongue out. Move it from side to side. Testing cranial nerve 12. And we already tested 9 and 10 with swallowing and saying ah, all that good stuff. You ever had any problems swallowing?
Never.
Okay, good. And we already talked about smell. No problem smelling or anything like that. No TMJ, no problems with your jaw or your teeth.
I don't think so. Not that I've ever
Okay,
noticed.
good. Well, I sure do. Thank you for answering all those questions. So the next thing we're going to do is just move on down the body. I'm going to check out your neck for symmetry. I don't see any JVDs. We'll palpate the carotid. Why wouldn't I do that at the same time?
Why you kill a person?
Correct. I would absolutely choke you, wouldn't I? So that would be bad. So I don't see any asymmetry, no moles. Skin color looks good. Skin turgor looks good. So we can go ahead. Excuse me.
You okay?
Excuse me. All right. So we're good there. Now I need to palpate your lymph nodes.
Okay.
So we can start back here, your postauricular, preauricular. That just means before and after your ear. Move it on down, move it on down. Sternocleidomastoid. Thing feels good there. Occipital. No abnormalities there. Come on down. Sublingual. Good here. Supraclavicular. I don't see any signs of lymphadenopathy. Everything looks good there. So now we can keep on moving.
Okay.
Next thing we're going to do is go to the chest. So at this point, I'm going to ask you to stand.
Okay.
Okay. So what I'm looking for here is just symmetry of the chest, making sure that there's no evidence of barrel chest, anything like that. Have you ever had any respiratory problems? No? Okay. Just take a couple deep breaths for me. Good deal. Okay. So the first thing I'm going to do, say 99 for me.
99.
Okay. I'm going to test for what's called tactile fremitus. So 99.
99.
Mm-hmm.
99. 99. 99.
Perfect. Let's turn on the other side. We'll do it again.
99. 99, 99, 99.
Perfect. Okay. And you can sit right there while I go ahead. I'll go ahead and listen to the back, and then we'll move on to the front.
Okay.
Okay. So if you'll just take some good deep breaths in through your nose, out through your mouth. Okay. And if you'll turn around to the front for me, do the same thing. In through your nose, out through your mouth. And last one. Perfect. Thank you so much. Lung sounds clear all throughout. I don't hear any bronchi. I don't hear any abnormalities, no signs of fluid. One more thing, while you're still standing, if you turn around, I'm going to test for symmetry of expansion. So take a deep breath in. Perfect. Thank you so much.
Yes, ma'am.
All right, now I'm going to listen to your heart. You can have a seat again if you'd like. Okay. So when we're listening to the heart, there are a couple different places you want to listen.
Okay.
You can listen over here. This is going to be at your second intercostal space. That just means in between the rib at on the side of, on the side of your sternal border. And that's going to be your aortic valve, which sounds good. Come over here to the left side of your sternal border at the second intercostal space is your pulmonic. Good. Come down to the third. It's going to be Erb's point. And then if I go down to the fourth, I'm looking at the tricuspid. And then this next one that we're going to listen to is the most important of all. It's where you can hear the heart sounds the best, your apical pulse. It's also your mitral valve, and it's at the fifth intercostal space, left mid-clavicular line. Okay, everything sounds good. I don't hear any murmurs. Your sounds are present, S1 and S2. Everything sounds good there. Okay, and now we'll move it on along. What I'm going to do now is ask you to switch to this lovely table I have here. Thank you for helping me out. And we're going to look at your abdomen.
Okay.
Now, I know you've got some medical history. You can pull it this way so you don't hit your head.
Sorry.
That's okay. I know you got some medical history, but when you're looking at the abdomen, that come on down just a little bit. Perfect. When you're looking at your abdomen, things are a little bit different. You want to make sure that you inspect, and then you auscultate, then you palpate and percuss.
Okay.
So that's a little bit different, switching things up a little bit. Okay, so what I'm going to do is just inspect right now. I'm looking for symmetry, any kind of, distension, or organs that might be enlarged. I don't see any striae. I don't see any abnormal hair. Everything looks good. Okay, so inspection is good. Next thing I'm going to do is auscultate, and I'm going to start in the right lower quadrant. Go to the right upper, left upper, left lower. And everything sounds good, sounds normal active. If it weren't normal active, I would listen for longer. So, and then the next thing you would do would be to palpate. And you can do light palpation, deep palpation, whatever. All kind of stuff you're feeling for there. Don't feel anything abnormal here, so we can go ahead and sit back up.
Okay. Right there, okay?
That's good. Maybe I should back. Perfect. Okay. Good deal, good deal. Okay, so now we're looking for extremities and stuff like that. So I would take a look at your arms. We can test the strength. Go like this. Now try to pull your arms back. Okay. Now push your arms like this. Push them against me. Good deal. So strength is good. Equal bilaterally. We can test your range of motion. So you can do, you can go like this and then rotate. Perfect. And then the other way.
Where did I just go?
Yeah, you did good. You did good. We're looking for edema. We're looking for temperature, any kind of abnormalities there. Skin looks good. I don't see any kind of abnormalities, so we should be good there. The next thing we want to do is the spine, so I'm going to ask you to stand up again.
Okay. Oh, sorry.
No, you're okay. I was going to do it for
Okay,
you.
right here.
So you're going to bend over and touch your toes. And I'm going to just lift up your shirt. I'm looking for any abnormalities in your spine. Anything tender when I touch?
No, ma'am.
Nope. Okay. All right. Now let's take a look at your hands while I got you standing. I don't see any signs of edema. Capillary refill is good, below 3 seconds. Go like this. This. Perfect. And then flex your fingers side to side. So range of motion looks like it's intact. I don't think we have to worry about that. Now let's look at the range of motion of your neck.
Okay.
So I want you to put your chin to your chest. And then tilt your head all the way back. And then put your ear to one shoulder. Put your ear to the other shoulder. Perfect, perfect. Now we're going to hyperextend at your waist. That just means bend backwards.
Okay.
Perfect. Now bend side to side. Awesome. You ever had any problems moving? Anything wrong with your joints? Nothing like that? Okay, good deal. So now I'm going to push on your shoulders. I want you to shrug. Perfect. So shoulder strength seems to be intact bilaterally. I think we're good there. And the elbows, you can hyperextend those. Well, right, you can flex them.
I'm sorry.
That's okay. That's okay. I should be telling you. So that's good. Okay, so it looks like we got full range of motion there. We may want to lay back down again for the legs. I think that would be easier.
Okay.
Yeah. That'll be good. Can we come on down just a little bit? Come on down. Perfect. Okay, so now I want you to raise your right leg. Put it down. Raise your left leg. Okay. Bend your knee and put your knee to your chest as far as you can.
Okay.
Perfect.
Well, my pants are kind of restricting. Okay.
That's okay. Other one.
I'm sorry.
Okay. Now do it again with this leg, and then turn that hip out. Perfect. Same thing on this side. Perfect. I think we're good. All right. Now I'm gonna let's look at your feet. So let's flex.
Okay.
Come on. Rotate. Turn it out. Turn it back in. Let's check cap refill here. Everything looks good.
Okay.
There's another pulse down here. What I'm checking is your dorsalis pedis. Okay. Everything seems to be intact there. So we're good. There are other pulses as well that you've got. You've got some all over your body. I would check the back of your knee, but since the one in your foot is good, that means your blood flow's good in your lower extremities.
Okay.
Okay? So, now comes the neuro part. We can stand back up.
Okay. Can we put them here?
Yeah, that'll be perfect. Thank you so much. So, the cerebellar functions, let's come back up just a little bit. That's okay. Cerebellar functions seem to be intact. She's walking. Her gait looks steady. I don't see any kind of, limping or anything like that. So what I'm going to ask you to do right now, we're going to do a couple of different things actually.
Okay.
I'm going to stand right here.
Okay.
I don't want you to hit your leg on that.
Yes, ma'am.
So what I'm going to do is use this, and we're going to test your sensation.
Okay.
So one end you can see is pretty soft. The other end, a little sharp, but not going to be painful.
Okay.
Okay? So if you'll just close your eyes, I want you to tell me what you feel.
Okay.
Soft or sharp?
Soft.
Okay?
Soft.
Try it again.
Hard.
All right.
Soft.
Hard.
Hard.
Okay?
Hard. Soft. Hard.
Perfect. All right. Thank you so much. Okay. And so another function that we can use, let's see if you can hop on one foot.
Okay.
3 times. Perfect.
Oh,
All right. Other foot.
sorry. Okay.
Good deal. Good deal. So that is also testing your cerebellar function. And then let's do, I want you to take my hands, squeeze them. Perfect.
Okay.
All right. Strength seems normal. Bilaterally. Everything should be good there. Okay. So now I want you to see if you can touch each finger to your thumb. Perfect. Perfect. And then now let's touch your heel to your opposite shin.
Okay.
Other one. Other one. One more time. Okay. Everything seems to be good, Miss Emily. I sure do appreciate all your cooperation and going through everything with me. I appreciate it today. What questions do you have for me?
That's really it.
Okay. All right. Well, I'll see you next time.
Yes,
Good luck
ma'am.
to you.
Thank
Thank you so
you.
much.